The Ministry of Health, together with Mulago National Referral Hospital and supporting partners, have commemorated the World Clubfoot Day under the theme, "Every child deserves a healthy start." Now, health experts have started a campaign in the country to identify children with clubfoot early so that they are managed and treated. The Director Health Services Curative at the Ministry of Health, Dr. Charles Olaro, noted that the ministry is in the process of moving clubfoot centers in all regional hospitals in the country to ease on the burden.
So we have this assignment of what? Finding missing cases. Let's get those cases done. I think the statistics has been given about 2,000 are born each year, but now we are at 52%. Which means that almost 1,000 of them. I have looked at that in the 5 years, we've seen about 5,200, which ideally should have been 10,000, which means that we are still many which are in the what? In the community.
Clubfoot is a world problem. Every other month, we get over 2,000 babies delivered in Uganda with clubfoot. It's quite big. And many of those babies, the parents are not aware of the clubfoot.
Clubfoot is a birth deformity affecting the feet of a baby, resulting into inward folding of the feet, and if not treated, can result into limitation in walking due to pain, failure to put on shoes, and social stigma and loss of socio-economic opportunities.
Over a period of time. And I'm glad that the Ministry of Health, working with the partners, has expanded this program because it's extremely expensive for people to travel all the way to Mulago for this service, and especially if they have to report for this service in the initial stages once every week. It would be extremely expensive, and that's why I think some of them end up turning up when they are already too lame to be corrected.
We want to call upon everybody, those of us surrounding us here in Mulago and all the areas around us, to be vigilant, to identify and pick all these babies from the community, and you send them to us. We have a clinic here in Mulago. It runs twice a week. We have a clinic on Monday and we have a clinic on Thursday. But every day, we have a team on surveillance.
Since the launch of National Clubfoot Program Uganda in 1999, 5,360 children have been enrolled in treatment with a success rate 96%. And with over 35 hospitals in the country treat and manage clubfoot free of charge when identified early.
It's not a project. So in 3 years' time, we hope that every orthopedic officer, every midwife would be able to identify a child with the clubfoot, and then that child should be given quality treatment.
Do research, and we want to be able to see, to know what could be causing these abnormalities, and then eventually we can work towards preventing these defects that bring a lot of misery in our communities.
World Clubfoot Day is an international day of celebration for the children born with clubfoot whose lives have been transformed by treatment, for the parents whose steadfast hope and dedication have been rewarded, and for the providers whose healing hands have guided thousands of little feet to mobility. Zahara Abigaba, UBC News.